What will I gain from this video? After watching this video, you will be able to confidently identify common hilar abnormalities. The radiological hilum is abnormal when the grayscale image of the hilum is too white, or the density of the hilum is increased, and this could be unilateral or bilateral. The size of the hilar shadow is enlarged or reduced, and this can be unilateral or bilateral. The position of the hilum is shifted. The shape of the hilum is distorted. Or in special circumstances, the boundaries of the hilum are ill-defined, and this is called hilar haze. What can give bilateral hilar enlargement? Both hila can be enlarged if the pulmonary arteries are enlarged, and this can be seen with pulmonary arterial hypertension. Here we can identify the descending branch of the right pulmonary artery coursing vertically parallel to the right heart border, and we can identify the descending branch on the left. Both have the normal orientation and density, but are too large. We also can notice that there are very few peripheral vascular markings within the lungs, and these are the hallmarks of pulmonary hypertension. When we see bilateral hilar enlargement and there is an increase in density, and also there is a lobulated appearance to both hila, we suspect that the enlargement then is caused by enlarged lymph nodes, and this can be seen with lymphoma, metastatic disease, sarcoidosis, silicosis, and occasionally infections. So when looking at bilateral hilar enlargement, it is important to keep in mind the concept of the H sign. If the H is present but is enlarged, think pulmonary hypertension. If the H is distorted and cannot be clearly identified, think of bilateral adenopathy. Unilateral hilar enlargement can be caused by either tumor, enlarged lymph nodes, or rarely can also be vascular in origin. In this case, we can identify unilateral hilar enlargement, and this is caused by a bronchogenic carcinoma. The hilar position can change. This can happen if there's extensive scarring within the upper lobes, as with previous granulomatous infection. Commonly, we see hilar shift following previous surgery, such as upper lobectomy. Sometimes we see a distortion of the shape of the hilum. In this case, we don't see the right heart border very clearly, and we could suspect that there's a right middle lobe pneumonia, or there is atelectasis within the right lung. We also see this linear density inferiorly. On close examination, we can identify branching structures that are leading towards this density, and this in fact was the inferior pulmonary vein that was draining aberrantly into the inferior vena cava. And this was part of a congenital abnormality that was giving this distortion of the hilar appearance. The normal pulmonary artery branches are distinct and have sharp edges. There is a situation where there is blurring of the contour of the pulmonary arteries. And this happens when there's leakage of fluids into the peribronchial and perivascular interstitium. This commonly happens with interstitial pulmonary edema, where we lose the distinctness of the hilar vessels. We can also see that there is some thickening of the soft tissues around the bronchi, and this is a patient with interstitial pulmonary edema. And this appearance of indistinct hilar vascular markings is called hilar haze. There is a sign related to the hilum, and this is called the hilar overlay sign. And what the sign says that if we can identify the pulmonary artery branches and the pulmonary hila distinct from a mass within the central portion of the thorax, then the mass has to lie either anterior or posterior to the hilar region. If the mass was originating from the hilum, then we would have a silhouette with the pulmonary arteries, and the pulmonary arteries would not be identified as separate structures. And remember the H sign. The pulmonary arteries and their main branches roughly form the shape of a letter H. This will help you also remember that the descending branches have a vertical course within the inferior aspect of the hemithoraces. So to recap, when looking for hilar pathologies, look for change in grayscale, change in size and position of the hilum. If you identify unilateral hilar enlargement, suspect tumor. If you identify bilateral hilar enlargement, suspect pulmonary hypertension or adenopathy.